Hi everyone, I would like to welcome you to the Specialty Nursing Info session. My name is Julie Alley. Before we get started, the British Columbia Institute of Technology acknowledges that our campuses are located on the unceded traditional territories of the Coast Salish nations of the Squamish, Tsleil-Waututh, and Musqueam. Now, I'd like to pass it over to Kathy Kennedy, who is the Associate Dean of Specialty Nursing at BCIT.
Great. Thank you so much, Julie. Yes, as Julie said, I'm the Associate Dean for Specialty Nursing, and I welcome you here today. We're going to be presenting on a few of our programs, not all of them, but you can see on the slide before you that we have several specialty nursing programs, and very happy to speak to you about any of them. And you can certainly reach out to the program heads in any of those areas if we don't cover that program or that topic with you today. All right, and you're going to hear today about how specialty nursing, we offer our programs to diploma RNs looking to earn their BSN in nursing. We have alternate pathways for LPNs to study in a few of our specialized areas, which we'll talk about today. And all of our programs do lend towards credits into the UVic Master's program. So once you have an advanced certificate in specialty nursing, you will be granted compensation towards your credits in the UVic Master's program, which is fantastic. A great relationship we have with both. So our specialty nursing programs, as you know, are designed for nurses who are already interested in working in specialty areas. And we have nurses who have a couple of different specialty advanced certificates sometimes, and not just one, but we're here for you if you want to learn a little bit more about our programs. On to the next slide. So there's two different ways that nurses move through our specialty programs. We have part-time delivery studies, which we now call flexible learning, and you can take our courses at your own pace, course by course, and you have up to 7 years to complete the advanced certificate. And if you did go course by course in the program rather than doing it all at once, it would range in programs. So usually it can take up to 2 years to complete the specialty. And then we also have a compressed time frame delivery, which is usually arranged through sponsorship from your health authorities or your employer. The majority of our learners do come through this way, and it takes place in a very condensed time frame. So typically you do your prerequisite courses over a distance, and then you would be coming into what we call our CTF model. So it's full-time, on campus, online, in the clinical environments, and so it's done in a much quicker and condensed format. Thanks, Julie. Next slide. A lot of people have questions about our clinical practicums, and so we always try to make sure that we arrange them within a hospital within your region that's close for you, so we wouldn't want to be putting you somewhere very far away from where you live. We do have multiple sites that we access across the Lower Mainland and across the province and on the island. We have shift work can be expected, and some of the clinicals are instructor-led clinicals, and other ones are done in a preceptorship model, depending on which programs that you're looking for and which course that you're looking for. And then it would be the responsibility of our learners to find their own transportation to the sites, and not usually accommodation. Usually it's close by where you live, but if required, that responsibility be on the learner. So who is this for? Certainly, as I mentioned in the beginning, it's nurses in Canada who are working or looking to move into a nursing specialty area. We also have, as mentioned, the diploma RNs seeking to complete their BSN or an advanced certificate. The LPN programs that I mentioned at the beginning are in particular offered in the perioperative area and the nephrology area. Sometimes we have learners, our undergraduate learners, that are taking some of our courses during their for that elective portion of their nursing program. And we of late have developed what's called learning pathways. And there's opportunities to complete some of these elective courses as you continue to move through your degree. And I did mention about the nursing program. So here's your outline for our website. If you want to click on there, we're not going to be speaking about every single one of our programs today, but we're definitely going to be hitting some highlights. So if you're interested in learning more about specialty nursing, about our entrance requirements or any specific programs, please feel free to get this information down. And we are more than happy, and any of the program heads or our program assistants are happy to speak with you if you have specific questions or you want to know if this is the right area for you or how you can move through our programs. They're more than happy to answer those questions. Perfect. So I think I'm going to turn you over to Jan Morrison. So she's our program head for a post-diploma BSN completion program. And over to you, Jan.
Well, thanks, Kathy. So who is this for? If you're a diploma prepared RN and you want to move up to a Bachelor of Science in Nursing with specialty certification, have I got a deal for you? Our program is designed to do just that. So most students will start out completing the specialty certificate proportion, which is up to 27 credits, and then move on to the academic portion of the degree, which is another 33 credits for a total of 60 credits. This is kind of a graphic that really illustrates it very well. So you would move through our specialty certificates, you go on to the BSN pathway, and then you graduate with not only a Bachelor of Science in Nursing, but also a specialty certification. And I believe that we are unique in Canada offering this pathway. So a lot of diploma prepared nurses find that they're hampered in advancing their careers because they need a BSN to move into teaching or leadership or community health positions. And so this degree is what you are looking for. There's a fairly straightforward application process. You just need to collect your documents, transcripts, go online, submit your application. And generally speaking, admissions turns those applications around pretty quickly. So you should hear back in short order. And then you can begin your program. You can take the courses, as I mentioned before, in any order that you wish. And all of the academic courses are offered every term. So I think that's it. Yeah. If you have any questions, don't hesitate to contact me. I'm more than happy to talk about the program. Thanks very much, Julie.
Hi, everyone. So I'm the next program head to introduce the perioperative program. And perioperative is just another term for operating room. So next slide, please, Julie. So what is perioperative nursing? So for those that are unfamiliar, perioperative nursing ensures safe care and provide patient care for those that require surgery. And just on the slide, there's a list of a few examples of surgeries that you may have heard of or even experienced yourself. So there's a huge range. So we go from ortho surgeries like knee scope, knee replacement, gynae surgeries like cesarean sections, and also general surgeries such as gallbladder removal and also appendix removal. So those are just a short list of the amount of surgeries that are available and that we do. And one of the most rewarding parts about being a perioperative nurse at the end of the day is just to be able to help fix a problem and ultimately give the patient a better opportunity for a quality of life. And then so many people may assume that perioperative nursing doesn't really involve direct patient care, but in reality they do. It just looks different. So perioperative nurses support patients receiving surgery through two main roles, and they're called the scrub nurse role and also the circulating nurse role. The scrub nurse role is often portrayed on TV that you've probably seen as part of the sterile team. So they're all gowned up in the blue gowns and they're kind of amidst the action, assisting with the surgeon. So in reality, they do assist the surgeon by preparing the equipment and also supplies, and they work very closely also to the circulating nurse, as they are a very restricted kind of in their as sterile team members. On the other hand, you have the circulating nurse role. And they're the ones that you usually see checking patients in, setting them up for surgery, and they help monitor and ensure the needs of the patient and also the rest of the surgical team. And similar to when you're taking off on an airplane, the circulating nurse just makes sure everyone's on the same page and ready to go before the surgery commences. Now, both roles provide patient care and advocate for patients, especially this being one of their most vulnerable times. Most of the time when you're in surgery, you're under general anesthesia or conscious sedation. So perioperative nurses are essentially the patient's like eyes and mouth, right? So speak for them and watch for kind of safety issues for them during that time. One of the challenges that you may see with perioperative nursing is gathering pertinent information, especially during check-in, because our check-in window is quite small. Like within 5 minutes, you're trying to build a nurse-patient relationship and that trusting relationship in that short amount of time. And so who is this for? Like Kathy mentioned earlier, we offer in perioperative program, we offer 3 pathways. So one of them is for RNs and BSNs who would like to work in the OR and also obtain an advanced certificate in the perioperative specialty nursing. We also offer it for LPNs who would like to also work in the operating room. And it's a very similar format to how we deliver the pathways, similar to the RNs and BSN. And we also have a special pathway for perinatal nurses. And these are nurses who work on the maternity unit. And oftentimes the unit has their own surgical team that does primarily C-sections. So we prepare the nurses and expand their scope of practice to be part of the C-section team. And then to be successful in our program, I would like just to mention a few attributes that may be helpful to have. So some of the things that we've seen is having a strong interpersonal skills and excellent organizational skills. You might say a lot of the perioperative nurses are a little bit OCD, but I think that may be similar to a lot of other specialties that you may hear of. You also have to have the ability to work very closely with your surgeons and also anesthesiologists and a lot of people in the room. So good communication skills is very important, and also being proactive. Also energy. I know that in the OR, it's like you're standing for a long time, so you do have to have a good physical stamina. All right, and then just on the slide here, you're going to see that this is what our program looks like. It's basically 25 credits in total with 3 theory courses in blue and 3 clinical courses in the pink. The first theory course is just the foundation overview, and then followed by the second theory course, 7250 or 7251. That's the scrub nurse role. And that's usually followed by a clinical, which is all about the scrub in 7350. And then you go back to the circulating nurse role, which is in 7450 and 7451. And then again, followed by a circulating nurse clinical rotation. And then the very last clinical, 7750, is the consolidation of both scrub and circulating nurse role. So that's kind of our 25 credits in a nutshell. And our theory courses are all available and delivered online, so distance learning. And then our perinatal program that I spoke of earlier, that's a modified pathway, so it's only 10 credits. And then so our graduates of the program are able to work with patients ranging from infants to elderly. As you know, surgeries happen to, can occur in all ages. You're able to work in rural or tertiary care units. So it can be in the hospital. It can also be in private surgical centers. And there's also opportunities for the perioperative nurse to expand their roles as RNFA. So that's the first assist. They are usually helping with their in surgery, helping with a surgeon in a more expanded role. All right, and we also have a little video for you from one of our past students, and it's about 1 minute video, and she's going to share with you her experience of the program.
So I completed the BCIT perioperative specialty nursing program in 2020, and what I liked about the program was that it was offered in a very organized way, where we did the clinical portion at the hospital and the theory portion at home through online learning. And before we went on to do our clinicals, we had a chance to practice and apply what we've learned in sim labs, and this was done in a small group setting, so we were able to receive immediate feedback on what we did well on and what we could improve on. And all the instructors were very engaging and knowledgeable throughout the whole program, and also shared with us some of their own real-life experiences as OR nurses. And I feel that this very well prepared us for clinicals. And overall, BCIT program provided plenty of time and resources for me to learn all the appropriate skills and basic knowledge prior to starting my career as an OR nurse.
Perfect. And just on this next slide is just a few other students, past students that we had, and what they have said about the program and their experiences with perioperative nursing. So I'll just give you a few minutes to look over that. And just like Julie said, you will be receiving the slide deck and this presentation, so you guys can always review what they said afterwards. And the next slide, please. I'll just, we have our contact information, so you can reach out to me through phone or email, and also the program assistant, Stephanie Strong, and that's her phone number and email as well. Thanks, everyone.
Hello, everyone. My name is Jean DeHaan, and I am the current program head for high acuity specialty nursing. For those who are unfamiliar with high acuity specialty, in true teacher fashion, let me begin with a definition. So high acuity nursing practice lives between the regular medical surgical units with patients admitted with acute illness and the intensive care unit that admits patients requiring life support. So in high acuity, nurses closely monitor patients to manage their complex acute illness and or identify a worsening illness status so we can address these changes early and use advanced interventions that may not usually be available on medical surgical units. Next slide, please. So there are a wide variety of learners who enroll into the high acuity specialty nursing program. We have BSN students who take our first foundational theory course, followed by our virtual clinical course. We have RNs with a nursing diploma who complete our advanced specialty certificate and use it to obtain their Bachelor of Science in Nursing via the BCIT post-diploma BSN program. And this was discussed earlier in our presentation by both Kathy Kennedy and Jan Morrison. We also have RNs that already have their BSN degree, but who are advancing their nursing knowledge and their skill set to work on these specialized high acuity units. So high acuity nursing is becoming, I would say, more and more relevant on general medical and surgical units. The patients on these units are sicker today than they were maybe even 10 years ago. And honestly, I anticipate that patient acuity will continue to increase over time, as it has over the last several decades. What high acuity specialty nursing education will afford you is a way to revolutionize your nursing practice, to care for patients with complex acute illness that have concurrent multiple health challenges. Currently, BCIT offers the only high acuity certification program in Canada, and the program has received accreditation by the Canadian Nursing Association. The high acuity program is offered in two ways. The first is a part-time option, which takes on average about 2 years by distance education. So that would be one course per term for you to complete at your pace. The second is a compressed timeframe option, which completes in 19 weeks, which is equivalent to about 2 terms. So you can decide how slowly or how quickly you want to complete the program. That said, I invite you to contact me directly to discuss options in our course offerings to accommodate both your personal and professional needs. Coming up next is a video testimonial from one of our recent graduates, Catherine Duncan.
Hi there, my name is Catherine, and I recently completed the Advanced High Acuity Certificate at BCIT. I completed this specialty nursing program as part of the training for the Burns Trauma and High Acuity Unit at Vancouver General Hospital. I applied to a high acuity unit after around a year on med-surg because I was ready for a challenge in my career and a fast-paced environment where I would have the opportunity to think critically and advocate for very sick and complex patients. Because of the nature and complexity of caring for high acuity patients, I'm very grateful to have the additional training under my belt. I can speak directly to how the high, of course, a motorcycle. Okay. Where's that? Okay. Hi there, my name is Catherine, and I recently completed the Advanced High Acuity Certificate at BCIT. I completed this specialty nursing program as part of the training for the Burns Trauma and High Acuity Unit at Vancouver General Hospital. I applied to a high acuity unit after around a year on med-surg because I was ready for a challenge and a fast-paced environment where I would have the opportunity to think critically and advocate for very sick and complex patients. Because of the nature and complexity of caring for high acuity patients, I'm very grateful to have the additional training under my belt. I can speak directly to how the high acuity program at BCIT equips nurses with the knowledge and clinical exposure they need to succeed in high acuity environments. What do I love about the program and career? One of my favorite things about the program was how relevant I found the material to my everyday practice. For example, in my current role, at the start of every shift, one of the first things I do before report is print out a cardiac rhythm strip for my monitored patients. The dysrhythmia interpretation and management component of this program gave me the confidence to interpret a wide variety of cardiac rhythms and readily identify concerning findings. The theory taught throughout the program was supported by case studies and clinical anecdotes from the instructors and my peers that brought the material to life. The instructors were great at not just telling us how things work and why, but also explaining why we need to know this and how it applies to our future patient populations. The oxygen supply and demand framework that serves as the center of the high acuity theory courses is incredibly useful. From the framework, I've developed a shift in my understanding, and this allows me to consider end organ perfusion in my patients in a way I never had before and anticipate worst case scenarios. Several different opportunities for simulations throughout the program allowed us to apply our learning, think critically, make mistakes, and grow as nurses in a safe environment, which allowed us to build our confidence for clinical. The clinical placement gave me a solid foundation coming into my unit orientation. I was given sufficient exposure to a wide variety of patients to meet my learning goals. I appreciated clinical debriefs where the students and instructor had the opportunity to learn from each other and discuss our learning in a collegial, judgment-free environment. My clinical instructors were fantastic, patient, and provided useful, constructive feedback. It was great to have the opportunity to learn from their experience and integrate some of their clinical pearls into my practice moving forward. My favorite thing about the nursing profession is the privilege of caring for people on their worst days and supporting them and advocating for them throughout the challenges of illness and hospitalization. In addition, it is very rewarding to bring the nursing perspective as a valued member of a well-functioning interprofessional team. I think nurses bring care, compassion, and humanity to life in all of the work we do, and I'm proud to be a part of that. Where do I see myself professionally in 5 years? One of my favorite things about my current unit is that with the variety and complexity of patients that we see, I feel like there are always so many new things to learn. I'll continue to seek out environments where I'm challenged and can further develop my critical thinking. I hope to expand my knowledge by continuing to seek out additional certifications and education. For example, just 6 months after completing the high acuity program, I just recently obtained my ACLS certification, which was recommended to me by both of my clinical instructors. I learned from the codes I've attended in person and from the ACLS course that I'm very interested in resuscitation and the incredible teamwork and knowledge needed to keep someone alive. I plan on pursuing additional training in critical care and eventually completing a master's in nursing to further research and education in the nursing field. I also see myself as a clinical instructor with the hopes of eventually becoming a faculty and teaching the next generation of nurses. I feel very grateful to have had the opportunity to complete the BCIT High Acuity Specialty Nursing Program, and I highly recommend it for students looking for a challenging, highly rewarding specialty where their assessment makes all the difference. Whatever you choose to pursue, I wish you the best of luck in the nursing field, and I look forward to maybe working together in the future. Thank you. Take care.
Yes, thank you so much. So if you would like more information about high acuity specialty nursing, please feel free to email me or our program assistant, Stephanie Wood, and we can answer any questions for you. Thank you so much for your time, and we really look forward to hearing from you. Thanks.
My name is Carly Iliades. I'm the program head for the neonatal nursing program here at BCIT. We can go to the next slide, Julie. So neonatal nursing is a subspecialty within nursing that works with newborn infants born with a variety of complications. They can range from things like prematurity, birth defects, infections, cardiac malformations, as well as surgical issues. Okay, next slide, please. So our program is very similar to the other programs that you've heard about today. It's for practicing registered nurses wanting an advanced neonatal certification or to complete a Bachelor of Science in Nursing. We also do have undergrads in our program, and they can currently take the first 2 theory courses during their BSN. We do prefer around 6 months of work experience in an acute care setting, but in saying that, we absolutely do accept new grads and undergrads into our program. So of course, if you enjoy working directly with infants and their families and can apply sensitivity and compassion in a high stress work environment, this program might be for you. Next slide. So generally, neonatal nurses work in a neonatal intensive care unit, but neonates can also be cared for in a variety of other settings. These may include places like the birthing room, a newborn nursery, palliative care, interhospital transport, home care, as well as neonatal follow-up clinics. Neonatal nurses are experts on fetal and neonatal development, the effects of maternal health, pregnancy and birth on the developing fetus and neonate, transition to extrauterine life, as well as neonatal resuscitation. Neonatal nurses use evidence-based knowledge and skills to provide family-centered, developmentally supportive, and culturally safe care to neonates and their families. A cornerstone of competent and ethical neonatal nursing practice is the ability of neonatal nurses to see infants as holistic beings with subtle but powerful abilities to communicate. Neonatal nurses practice with a trauma-informed lens, understanding that infants are extraordinarily vulnerable and that traumatic, stressful, and painful experiences are associated with adverse short and long-term outcomes. Neonatal care is complex and rapidly changing. It requires interprofessional collaboration, extensive family involvement, as well as the ability to manage ethical challenges and uncertainty. People who generally enjoy working in this area obviously usually really like babies, but also enjoy working with and supporting families. Family-centered care is really at the forefront of what we do. The NICU is a very fast-paced environment, but it's also very scheduled, and we work in a very methodic and organized way. We look after a wide range of infants, ranging from extremely premature infants requiring mechanical ventilation, central venous access, maybe multiple medication infusions, right up to babies that we call feeders and growers, who are just learning how to feed and need to grow a little bit before they can go home. A major focus of neonatal nursing is providing trauma-informed and developmentally supportive care to infants. We have learned a great deal over the past many years about how stressful and traumatic the NICU environment can be for both infants and their families. So our main focus is really providing supportive care to ensure positive neurodevelopmental outcomes. Next slide, please. So program overview. There are multiple paths to becoming a neonatal nurse. Like I said before, you could take our first 2 theory courses in your undergrad. Then you might do your final preceptorship in the NICU and go right into working in a NICU after graduation. or you might finish your BSN, work for a while in another area, and then decide to specialize. As mentioned earlier, there's the option to take our program course by course, and then there's also the option of the Health Authority sponsored compressed timeframe program. Next slide, please. This is our program matrix. So the neonatal program is comprised of 24 credits. There are 21 credits of core courses, which is a combination of both theory and clinical courses. And then there are 3 elective credits, which you can choose from some of our neonatal options, or you can choose electives from one of the other specialty programs. So there really is lots of options there. And next slide, please. And these are just some student testimonials of things that people have said that have done our program before. So I'll just give you a couple of minutes to read that. I like how someone said it was quite fun, and now I have the greatest job in the world. I definitely would agree with that. So please feel free to reach out to me anytime. My contact information is on the next slide. And like somebody else said, there's no stupid questions, and we're always happy to connect with you guys and answer any questions that you might have.
My name is Farah Jetta, and I am the program head for the perinatal specialty program. Next slide, please. So what is perinatal? So perinatal registered nurses work very closely and very collaboratively in partnership with childbearing individuals, their newborns and their families. And the idea is really to provide competent, safe patient care, education, and support to families as they transition from pregnancy or antepartum into childbearing, which is intrapartum, and then into postpartum, which is post-delivery, and the newborn trajectory. A very big component of perinatal nursing practice is working with patients and families, and there's a lot of collaborative decision-making, a lot of education, and a lot of support. There's a lot of one-to-one care, especially in the intrapartum or the labor and delivery area of perinatal. And because perinatal is very unpredictable, obviously very dynamic, because we don't know when babies choose to arrive. We have some theories, but we don't know all of it, and it can be very, very unpredictable. Perinatal nursing and nurses require that, obviously, like other specialties, that we have a strong knowledge base, a very sort of strong understanding of technical expertise. And because we're making decisions along the way and adapting these decisions from moment to moment based on, changing patient situations, excellent decision-making and relational nursing practice are key. Next slide, please. So who is this for? So like very many programs before that have spoken, registered nurses seeking an advanced perinatal nursing certification, diploma RNs that want to come in and complete a certification. We also, like many other programs that have spoken already, offer a few of the courses to undergraduate nursing students currently completing their BSN program. And as I mentioned, in the context of perinatal, those, people thrive in this specialty if they enjoy working with childbearing women and individuals, newborns, families. Because perinatal can be quite unpredictable, it can also be very sort of fast-paced. And so, those that thrive in fast-paced environments, that, really thrive on strong organization, prioritization, communication skills. We work very closely in a multi sort of team environment. So effective team members, strong communication, strong collaboration, skills come in handy, being very adaptable and agile because things are changing, especially in the labor and delivery component of perinatal nursing. Things can change very, very quickly. So being adaptable, knowing, what and how to get, and where to get support, and being very self-reflective because you learn something new almost every shift, if not sort of every experience that you go through in the perinatal area. Thanks, Julie. Next slide. So the program overview, it has been a benchmark for perinatal nursing practice in British Columbia and beyond for many decades now. A perinatal program is a comprehensive program that combines in-depth theory. We work very hard to insert simulation and other lab experiences and clinical courses delivered by very knowledgeable and experienced faculty, but also faculty that are immersed in clinical practice currently and really can bring their clinical experience into the classrooms and into the clinical courses, and are very passionate about what they do, like so many other specialty programs I've mentioned already. And again, like many other programs, we have part-time sort of offerings that can take an average of 2 years if taken course by course, as well as full-time sponsored CTF pathways that our Associate Dean spoke of a bit earlier today. And a lot of our theory courses are offered distance and online, allowing that flexibility. Thanks, Julie. Next slide. And so here's a little bit of our course matrix. And our course matrix consists of 24 credits. And you can see that we've got 3 theory courses, as well as 2 workshops, 2 clinical courses, and then an elective course. And the way that it's designed is, there's a prerequisite theory course followed by a workshop, and then, another sort of theory course that focuses more on advanced perinatal practice, sort of high risk and challenges in perinatal nursing. We've got things like neonatal resuscitation program. We've got, a workshop on how to interpret fetal health tracings. And then we've got sort of the infant feeding course as well. And then 2 clinical courses, mostly run usually with an instructor support for the first one, and then the second one is usually a preceptor one. And we're very much working hard to keep our learners in their clinical sites wherever possible, to really just, begin to assimilate into the role of the perinatal nurse in your clinical unit. In order to get the certificate, the last component is a 3-credit elective, and we have multiple options for learners to choose from. Next, Julie. And so perinatal nurses work primarily in acute labor delivery, or what we call birthing units, as well as antepartum units, which is, individuals who are pregnant that are needing hospitalization, and postpartum units, which is after the birth of the baby. And so there's a lot of variety where nurses can be working within a hospital, but in multiple units. And so that can be very exciting for nurses when they're working in multiple areas in the same hospital and are called what we call cross-trained. Other areas where, perinatal nurses might be seen are breastfeeding clinics out in the community, public health nursing, or community health nursing out in the community, as well as I mentioned, antepartum and postpartum units. So there's a lot of variety, a lot of flexibility. People can rotate in and out of different roles in perinatal nursing. So there's a wide scope. Next slide, Julie. And so in terms of, this is some of our faculty and some of our support staff that make everything we do very possible. And so some of the things the students have said in the past that have taken our courses, one person has said that the clinical was the most important and helpful and brought everything together for that learner. Another learner said, I found it all relevant and excellent learning. Somebody else said simulation was very helpful to bring together all the content learned from class and apply it in a realistic situation. I learned a lot from my clinical experience. And lastly, somebody said, I loved this program. The content was relevant. The professors were amazing. Great course, would highly recommend. Next slide, Julie. And this is my contact information here. Please feel free to contact me via email if you've got any additional questions. And our program assistant is Elaine Innes, who is also very knowledgeable and will be able to navigate some of the questions you have as well. Thank you so much.
Hi, everyone. Thanks so much for having me. I am one of the faculty members for the PEDS Emerge program at BCIT. I can't speak highly enough about the program. I actually completed it myself as a new grad, and then completed my master's through the BCIT UVic specialty pathway. So the support and the confidence it gave me in my own practice, and then the opportunity since doing it has been huge. So again, I can't speak highly about it. Next slide, please. So who is this program for? So this program is for anyone that's either currently practicing, registered RNs, wanting an advanced pediatric emergency nursing certification, or to complete their specialty Bachelor of Science nursing in specialty nursing. What's special and unique about our program at BCIT is that you don't need to work specifically in a pediatric emergency setting. In BC, we have 2 of them that are solely peds emergencies. BC Children's and Surrey Emergency has a pediatric unit. Again, you don't need to specifically work in those sections. As we know, kids will show up at any emergency department. So working in any emergency department that sees kids, this program would be awesome and beneficial for you. We really need peds nurses everywhere. So really, again, you don't have to specifically work in one of those 2 settings. But what you do need to do is you need to enjoy working directly with children and their families. Again, this is a setting where pediatric patients, their families are likely most vulnerable. Their kids come in sick. Sometimes they could come in very sick. So this is an area where we help them, and we really focus on family-centered care here as well, you know, not focusing just on the child, but their families as well. So again, you just really need to have a passion and a want to work with children. Really, you need some strong interpersonal and creative thinking skills, especially when communicating with young people. Not one child is the same as the other. So you get really creative in how you communicate with different age groups, and even of the same age group, communicating with one child can look very different than how you would communicate with another child. Again, we would prep you and give you the skills you need to learn how to do that. And then again, the specialty nursing program doesn't require relevant work experience, so you don't have to be already working in a pediatric emergency setting. Obviously, the more pediatric experience you have, the potentially easier the flow might be for you. But again, you can be new grad or working wherever and just need that desire and want to work in a kind of fast-paced, high acuity. You really don't know what's going to come through the door in a pediatric emergency. We'll go to the next slide, please. So just a quick program overview. So again, this program is relatively new. I think I completed it in 2016 and it was kind of new back then. It's really unique. I don't think there's any other program across Canada that has this program. You're going to learn everything you need to know about children, emergency nursing. We give you tons of opportunities, simulations, practice experience, clinical experience to kind of equip you with the tools you're going to need. And we're there alongside you the whole time, helping you through it. Again, if you have children in your own life or nieces and nephews, or you've worked with children, you'll learn very quickly how unique the healthcare needs and how just unique children are in their own ways. Again, communication is a big thing in pediatric nursing. You have to really learn to find that special skill of communicating with different age groups and children on different levels. Really, you need to just, again, I think I said it before, but really have that passion. I really enjoy working in an emergency setting with pediatric patients, not only because I like the high, fast-paced acuity, but I also just love being enthusiastic and playful, and you get to be goofy and kind of feel like a child sometimes yourself when you interact with them. We do lots of different things, coping things with them during difficult procedures. We do lots of play therapy with them. So again, just really have that drive and passion to work with children. And if that's something that interests you and you're really interested in kind of that higher acuity, faster pace, kind of organized but not so organized setting, Peds Emerge would be the place for you. We can go to the next slide. Again, I think I said this again, but again, we really must have excellent communication skills so they can provide, or so we as nurses can provide a safe, supportive environment for young patients. And again, we need to focus our communication not only with our young patients. Yes, we need to be able to communicate at their level, their developmental stage, but we also need to focus on our communication with families. How do we interact with parents? How do we communicate what's going on? How do we prepare them for the next steps of their journey through the emergency department, or what might happen, or if we need to admit them to hospital or send them to the OR, or if it's a really sick child and they're going to go to ICU, how do we kind of prep and prepare the family? So that's another huge thing that we work through in the program, and then you learn how to kind of have those skills needed to prep the family. Next slide, please. So like everyone else has kind of alluded to, there's kind of two different options that you can do for the PEDS emergency program here at BCIT. So there is a part-time program. It takes roughly 2.5 years to complete. It's distance, it's online. It gives you the flexibility to kind of learn at your own pace. You'll do some clinical experiences in areas in your own community or your own province, and then you can kind of just work at your own pace. It's one course at a time. We have people or students right now from back east doing the program. So like I said, you can take it anywhere, and then your practice area would be in your own community. The other option that we do have here in BC is the CTF option. So this one requires, again, you get sponsored usually through your health authority or your employer. You would have your 2 prerequisites, which would be a dysrhythmia and then just a general adult emergency introduction course. And then you would move in after that to 3 months of pediatric theory courses and clinical. The clinical is done 2 different clinical courses. They're both done in BC at 2 different clinical sites. So one would be at BC Children's Hospital, and then the other one is at Surrey Memorial Hospital in the Pediatric Emergency Department. Next slide. So again, this just gives you a little bit of an overview. So like I said, you're going to start with 2 theory courses. You're going to do a dysrhythmia course and then the general adult emergency theory 1 introduction course. Once you have those completed, that one is the 7110 is done online. Once you have those ones completed, then you move into the pediatric component. So there's three theory courses that you will take. And then we do offer PAL, so that would be one other course you would take. And then there's 1 clinical experience. The clinical, if you're in the CTF program, starts kind of right at the beginning when you're in 7610. So that's your first pediatric theory course, and it runs throughout the whole entire program. You get tons of clinical experience at the 2 different sites. Students have great time with those clinical experience and learn so much. We also, throughout our program, integrate tons of simulation. In the CTF program, they get to do sims almost weekly, it feels like, sometimes every other week, but lots of simulation opportunity for learning, practicing, and kind of growth in your own clinical practice. We can go to the next slide. So now we'll just watch a quick little video from a previous student and a previous faculty member about their experience in this program.
So thanks, Kyle, for coming out today. I know it's super busy in today's world, but I appreciate you taking a couple minutes here to speak to the program. So if you'd like to maybe just say hi and introduce yourself.
Perfect. Hi, my name's Kyle, and I previously worked in the emergency department at Children's Hospital. And currently I am a coordinator with the Vancouver pediatric team and a clinic nurse with Insight.
Great. Yeah. Well, thanks for coming, Kyle. Thanks for sharing all of your insight. So, thinking back, you took our program a couple of years ago now. So just thinking back to that time when you joined, why did you decide to, take the leap and join the program, and what did you envision for yourself?
Yeah, the emergency department is one of those places where you get to be the jack of all trades, master of none. And it's a controlled chaos, and it's a perfect mix for getting a lot of things accomplished, but it doesn't really give you that opportunity to take a deep dive and to really understand and hone certain skills. So what I was really looking forward to with the program was the opportunity to consolidate my knowledge and my practice, and to get into that simulation world and prepare for those one in a million cases that PEDS is known for.
Yeah, I'm so glad you spoke to that, because that's a huge advantage of taking the time in these programs, right? Is to the ability to be a student again, and to be vulnerable and to learn all these things that we may not, especially in emergency, have the time to actually understand some of the things that we're seeing, because it's quite chaotic. So I appreciate you saying that. That's amazing. Yeah. So reflecting on your time at BCIT, what did you like about the program? What did you value in it? You know, reflecting on those 3 months.
Reflecting back on it, I really valued my time with the instructors. I felt coming into this experience, in some ways, I felt like a nursing student all over again. But then working with my instructors and and the clinical instructors, it was as if we were peers and we were all learning together, which was a great environment to be in. The other piece that I really valued was the simulation, the amount of simulation practice, the equipment that was accessible to us. I felt that I could directly see from before I started the program to after my confidence in the critical care setting and just being able to navigate what should be happening, how to advocate for clients, and just the communication level that should be there.
Yeah, I couldn't agree more. The team we have in our little program is quite amazing, and you know, not only the experience that our instructors have, but also I think the networking as well. You know, pediatric emergency can sometimes be a little bit of its own little world. So that networking, learning from people so experienced and so knowledgeable, it definitely puts a perspective on everything. And I mean, branching off of that as well is that simulation staff that we have as well, and the experiences the work that they put into, for us as faculty and for you guys as students is quite amazing, and that's great. Well, thanks, Kyle. So the last little bit I would love you to speak to is, again, reflecting back, before you were entering the program and as you were moving through it, is where did you envision yourself? Where did you envision yourself going with nursing, and where did you think it was going to take you?
Yeah. My big plan was either education or leadership. And one of the other pieces that allured me to the program was the frameworks and the processes that would help with teaching and supporting new staff and preceptors and in the emergency department. And yeah, just kind of looking at different master's programs for leadership and policy type things.
Great, yeah, and that's why I was really excited to have you come and speak, because now working in a pediatric public health lens, it just goes to show that the skills you learn, in a pediatric emergency program can be extrapolated and threaded through any sort of either emergency or pediatric care that you kind of venture off into, and so that's amazing. Great.
Yeah.
Well, thanks, Kyle. Yeah, I appreciate you. I appreciate you coming, and I appreciate you taking the time out. And we'll see you around.
Sounds good. Thank you very much.
Perfect. So that again was just a little video from a previous student. So if you have any questions or anything you want to know more about, feel free to, my contact info will pop up shortly, but feel free to contact me or reach out, ask any questions, and I will help you the best I can. Without further ado, I'll pass you over to Sarada for the next portion.
Hi, everyone. My name is Sarada Ramazini. I am the program head for the emergency and the pediatric emergency nursing specialty program. So what is emergency nursing? It's a specialized area that has an energetic environment, is unpredictable, where quick decisions are made that positively influence patients' lives. So who would this be for? So next slide. Two different students that this would be for. So RNs looking for emergency certification, who are also completing their specialty BSN in emergency, and undergraduate nursing students currently completing an accredited BSN program, and they are able to take up to the first 2 courses of our program. Now, some characteristics that are important for ER nursing. So strong detailed assessment skills. Attention to detail is very important. Our patients don't walk in through the doors with a diagnosis. We essentially act as detectives, trying to figure out what's going on through our assessment skills. And we identify these red flags, which are the clues to figure out what's going on with them and how to best treat them. You also have to have a curious mind. So one thing I really like about ER nursing is the opportunity to learn something new every shift. You'll never know everything. Being curious and always wanting to know why is essential for this area. Making order out of chaos. The ER environment is very fast-paced and chaotic at times. So being able to really slow down, taking a deep step back and looking around and thinking about your priorities and who your patient is. This is very vital as things can change from 1 minute to the next. Being proactive. So this is essential because planning ahead and being able to anticipate your patient's needs is key. Falling behind and then you start to run into trouble and then you're more reactionary. This really is not good. So being able to really plan out and think ahead of your steps is really necessary for ER nursing. And also knowledgeable. So strong pathophysiology foundation. Our theory courses and clinical experiences are patho heavy. Our curriculum is designed to introduce foundational concepts early in the theory courses and then continue to build on those concepts throughout the remaining theory courses and clinical experiences. So if this is something that interests you and you have some of these characteristics and would love to work in a dynamic, fast-paced environment, emergency nursing may be for you. So the emergency nursing program has been around for over 35 years. Over the years, we've learned what nurses require to be successful and safe working in the very vibrant environment of the ER. Our approach is very learner-centered. We recognize all nurses have a tremendous amount of knowledge and experience. Our approach is collaborative, utilizing a lot of different tools and resources to really meet our students where they're at in their learning. The program is a blend of comprehensive curriculum of both nursing theory in emergency and clinical practice. The core courses provide the necessary pathophysiology, assessment framework, and nursing theory to allow nurses the opportunity to care for a diverse range of illness and injury from a wide age spectrum. Our program consists of 6 courses, 4 theory, and 2 clinical experiences for a total of 24 credits. And we run 2 different models. We run the distance, which is more of a slower pace over a 12-week term. It's using the guided learning models and as well as telephone and Zoom tutor support. If you work full-time, you would register for 1 theory course per term, although this can vary depending on your additional commitments. And also we do the compressed time frame. If you're interested in taking this more in a compressed time period, please reach out and let us know. So these are some of the things that students have said. I'll just leave this up for a couple of seconds. Right. And then for those nurses with shared interest in both emergency and critical care nursing, BCIT also offers a combined program. Please feel free to reach out to myself or Maya if you have any questions down the line, and we look forward to hearing from you.
And now we'd like to open up the floor to our Q&A portion. If anybody has any questions, please feel free to kick yourself off mute or post your questions or comments in the chat. While we wait for that, I'm just going to put it out to the next slide, which is our social media handles and our links to visiting the website and upcoming info sessions as well as program advising. It looks like all of our questions may have been answered during the presentation. Now, with that, feel free still to post in the chat, but while we wait for that, I'd like to thank all of the program heads that came and presented today, as well as Kathy Kennedy and Erin Jerry for her technical support during this session. With that, I wish you all a wonderful sunny afternoon. I'll stay on the meeting for another 5 minutes. Oh.
There's a question from Brady regarding the approximate cost of the critical care program.
Yeah, I was just typing that out, but I'm happy to answer.
I wasn't sure if you saw my tag yet.
I did. Thanks, Alicia. I would suggest, Brady, just to reach out to Luda or Jenna, and they can go over the costs with you. So it depends if you're doing it as a sponsored student, then of course that's paid by your employer. And then if you're looking at doing it as an independent learner, just paying for yourself course by course, they can go over the cost structure for that. It is all online as well if you want to take a peek.
Thank you for that, Kathy. I think we may have answered all the questions in our chat. Yeah, we have. Okay, so with that, thank you to all the program heads, Kathy and Erin, for attending, and everybody that took the time to attend this session. You will receive an email next week with a link to the slide deck, all the videos, and the presentation. Thank you. Have a great afternoon.